my name is Danielle. I'm a nurse practitioner student. I'm going to be doing a complete head-to-toe assessment on you today. I'm going to first wash my hands. Can you go ahead and tell me your name?
Rodney.
And can you tell me why you're here today?
Just for a checkup.
And do you know where you're at right now?
At the hospital.
Alright, very good. And do you know what day of the week it is?
It's Friday.
Very good. Alright, the patient is well dressed. His respirations are even and non-labored. He appears to be in no acute distress. There's no foul smell coming from the patient. His speech is fluent and easy to understand. He maintains eye contact and his affect is normal for the situation. Alright, for this assessment I'm going to start all the way from the head, go all the way down to your toes. Do you have any questions before we get started?
I don't think so.
Okay, very good. Do you have any allergies to any medications or latex?
Nope.
No? Alright, perfect. And do you have any medical problems?
No.
No? And do you take any medications daily?
No.
And have you had any surgeries in the past?
I've gotten my gallbladder.
Okay, very good. Alright, well let's go ahead and get started. First I'm going to start by palpating your head. I just want you to let me know if you feel any pain or discomfort or tenderness. I don't know any lesions or masses. Any pain?
No.
Alright, I'm going to have you look at me. And I'm going to go ahead and have you lift your eyebrows up, wrinkle your forehead. Very good. And go ahead and puff out your cheeks. And go ahead and squeeze your eyes closed. I'm going to try to open them. Don't let me. Alright, very good. I'm going to have you clench your teeth. And I'm going to try to open your mouth. Don't let me. Alright, very good. Next, I'm going to have you go ahead and close your eyes. I'm going to go ahead and touch different parts of your face. I want you to let me know which parts I touch. Alright.
Forehead.
Alright.
Left cheek. Right cheek. Chin.
Very good. Alright. Next, I'm going to go ahead and palpate your sinuses. Let me know if you feel any pain or tenderness. I'm going to start in the maxillary area and move to the frontal area. Any pain or tenderness?
No.
Alright, very good. And I'm also going to palpate the orbital structures of your eyes. It appears to be symmetrical. There's no abnormalities noted. Any pain or tenderness?
No.
Okay, very good. Alright, next I'm going to go ahead and start with your eyes. The eyes appear symmetrical to your head. I don't note any redness or drainage. The conjunctiva is pink and moist. Sclera is white. The irises appear to be normal bilaterally. Next, I'm going to go ahead and do an ocular motion exam on you. So what I'm going to have you do is look straight at my pin light here. Don't move your head, just follow the light with your eyes, okay? So go ahead. All right, very good. Next, I'm going to go ahead and test your pupillary response. I want you to just look straight at me, and I'm just going to shine this light in your eyes, okay? It's going to be a little bright. All right, very good. Your pupils are equal, they're round, reactive to light and accommodation. The last part of this eye exam, I'm going to go ahead and test the corneal light reflex. So I'm going to have you just look at this TV back here, and I'm just going to shine this light in your eyes, okay? Just keep looking at the TV. Very good. The corneal light reflex is normal. All right, next I'm going to go ahead and move on to your nose. Your nose appears to be symmetrical to your face. Do you feel any kind of tenderness upon palpation?
No.
No, very good. All right, I'm going to have you go ahead and look up at the ceiling. All right, the nares are patent bilaterally. I don't notice any kind of erythema, no swelling, no drainage. All right, you can go ahead and look back normal. All right, next I'm going to go ahead and move on to your ears. The ears appear symmetrical on your head. I'm just going to go ahead and palpate. Let me know if you feel any pain at all.
No.
All right. Next, I'm going to go ahead and look into your ears. All right. Let me know if you feel any pain or have any problems. All right. The tympanic membrane is intact. The color is a pearly gray. All the landmarks were identified. All right, also, tympanic membrane is intact, pearly gray in color, and all the landmarks were identified. The next part of this exam, I'm going to do a little bit of a hearing test on you. So I'm going to step 5 feet away. I'm going to whisper a word to you. I want you to let me know what word you hear, okay?
Okay.
And just, I want you to stare straight ahead, okay?
Okay.
All right.
Warm.
All right, perfect.
Cold.
All right, very good. The patient has passed the forced whisper hearing test at 5 feet bilaterally. Next, I'm going to go ahead and palpate your tympanic arteries. All right, perfect. Next, I'm going to go ahead and feel for your jaw here. I'm going to have you open your mouth real wide and close and open again. And go ahead and slide your jaw side to side. Alrighty, no crepitus, no TMJ was noted. Alrighty, perfect. Next, I'm gonna go ahead and inspect your neck. Your neck is symmetrical, no pulsations, no lesions, no masses, nothing out of the norm. I'm gonna go ahead and palpate your lymph nodes. I just want you to let me know if you feel any tenderness upon this palpation, okay? Any pain or tenderness?
No.
All right, very good. And the trachea does appear to be midline. That's very good. All right, next I'm going to go ahead and move on to your mouth. So I'm going to have you, for this inspection and this assessment, I'm going to have you open up wide. I'm going to use the pin light, and I'm going to assess the buccal mucosa, the tongue, the teeth and gums, the bottom of the mouth, and as well as the palate and the tonsils, the floor of the mouth. Very good. And then I'm going to have you open up your mouth again and say ah. All right. The uvula and the soft palate rise midline. And one last test of the mouth. I'm going to have you open up and stick your tongue out for me. All right. The tongue appears to be midline. No tremors are noted. Now, as there was not enough saliva, I would normally test to ensure that the gag reflex is intact. If I were to do this test, I would use a wooden tongue depressor to do so.
Okay.
Okay, perfect. Next, I'm going to go ahead and assess your carotids. I'm going to start on the right side. All right, I would rate that as a 2+, and that would mean that it's neither bounding nor weak. Also rate this side as 2+ as well. I'm next going to auscultate for any bruits of the carotids using the bell of my stethoscope, okay? For this, I'm going to ask you to hold your breath. So hold your breath for me. Very good. Breathe normal for a moment, and then go ahead and hold your breath again. All right, perfect. Go ahead and breathe normal. This next test, I'm going to go ahead and test the range of motion of your neck. So for this one, I'm going to have you go ahead and bend your head forward to your chin to your chest. Do you feel any pain or discomfort with this motion?
No.
All right, perfect. Then I'm going to have you go ahead and bend your head back. And then go ahead and put your right ear to your right shoulder. All right, left ear to left shoulder. And then your chin to your right shoulder. And then the other way, your chin to your left shoulder. Any pain with any of these motions?
No.
All right, very good. Next, I'm going to do the same motions, but I'm going to test your strength against resistance. So I'm going to have you put your chin down, but I'm going to try to push against you, okay?
Okay.
So go ahead and push your chin down. Perfect. And head back. Perfect. And right ear to right shoulder. Bend it down. Perfect. And left ear to left shoulder. Perfect. And then your chin to your right shoulder. Perfect. And the opposite. All right, very good. Any pain or discomfort with those motions?
I don't think so.
Okay, the last one on this side, I'm going to have you ask you to shrug your shoulders, and I'm going to try to push your shoulders down, so I want you to resist that, okay? So go ahead and shrug. All right, perfect. All right, for the next part of the exam, I'm going to go ahead and move to your back, okay? So you just stay right where you're at.
Oh, okay.
All right, for this part of the exam, I'm going to identify your thyroid gland. I'm going to first identify the trachea and use that as a guiding point to guide down to the thyroid cartilage. I'm going to have you go ahead and bend your head forward and go ahead and swallow for me. Very good. All right, you can go ahead and sit up. The thyroid is of normal size and shape, no abnormalities, no goiters present, okay? Now I'm going to go ahead and assess your back. Your shoulders appear symmetrical. The chest is also symmetrical, no abnormalities, no masses noted. The chest AP diameter is 1 to 2, and there's no barrel chesting noted. Okay, I'm going to go ahead and assess. Let me know if you feel any pain or tenderness.
No.
No? All right, perfect. For this next, I'm going to ask you to bend forward a little bit. I'm just going to go ahead and palpate your spine. So go ahead and let me know if you feel any pain at all. Any pain? All right, the spine appears straight, no vertebral sublux noted. All right, you can go ahead and sit up. And then next, I'm going to go ahead and test for CVA tenderness. I'm going to percuss your back. Basically, just thump on your back. Let me know if you feel any pain or discomfort with this motion, okay?
Okay.
Any pain?
No.
Tenderness? Okay, I'm going to do the other side. Any pain?
No.
All right, perfect. All right, lastly, while I'm back here, I'm going to go ahead and listen to your breath sounds. I'm going to listen in all 5 levels. Whenever you feel my stethoscope on your back, go ahead and take a big deep breath in and out for me, okay? All right, dear, take a big breath. I'm also going to listen to your lateral lobes, and all of this assessment is going to be using the diaphragm of my stethoscope.
Okay.
So just take another deep breath for me. All right, very good. All right, breath sounds are clear, equal bilaterally, no wheezing, no crackles heard.
Huh?
All right, perfect. All right, now I'm going to move back to the front, obviously. And I'm going to go ahead and assess your chest. Your chest appears to be symmetrical. Your respirations are even and non-labored. Your skin appears to be warm and dry. Normal hair distribution, color normal for ethnicity. Chest rise and fall is equal. I'm going to go ahead and palpate your chest. No subcutaneous emphysema noted. No thrills, no pulsations. I'm going to go ahead and listen to your chest now. I'm going to listen to your lungs. Using the diaphragm again, I'm going to listen at all 5 levels again. Again, when I do go ahead and place my stethoscope on your chest, make sure you take a big deep breath in and out for me, okay?
Okay.
Big breath. Very good. Breath sounds are clear bilaterally. No wheezing, no crackles, no diminished lung sounds. All right, perfect. All right, next I'm going to go ahead and have you, for this next exam, I'm going to have you go ahead and lean forward. You'll take a big deep breath in, exhale, and then you're going to hold your breath for me during this part. I'm going to use the bell of my stethoscope to test for any murmurs heard over the valves. I'm going to first locate the mitral valve, which is at the mid-clavicular line, 5th intercostal space. All right.
Okay.
And then, yeah, lean forward and go ahead and take a deep breath in and hold it. All right, first listening to the mitral valve. And then I'm going to move up to the tricuspid. And then Erb's point. And then to the pulmonic. And then over to the aortica. All right, dear, go ahead and take a breath for me. All right, no murmurs were heard, so very good, you passed that one. Now I'm gonna go ahead and assess your arms. I'm going to first start off with your hands. All right, your hands appear to be warm and dry. Skin is normal. Your fingernails appear normal. Capillary refill is less than 2 seconds. No clubbing noted. No cyanosis. No ecchymosis, no wounds, no lesions, no bruising noted. All right, next I'm gonna have you go ahead and open your fingers up wide for me. Sorry. And then go ahead and squeeze your hands shut. All right, and open them up. And I want you to touch your thumb to the base of your pinky. All right, perfect. And then you can go ahead and relax them. And I'm gonna have you lift your hands up and down. All right, very good. Any pain or discomfort with any of those motions?
No.
All right, perfect. Next, I'm going to have you go ahead and test the strengths of your wrists. So squeeze your hands closed for me and flex your arms up. I'm going to go ahead and pull, and I want you to resist me. Very good. And now I'm going to push, and I also want you to resist me. Very good. Now go ahead and move your hands around. Just going to feel. No popping, no crepitus, any pain or discomfort with any of these motions?
No.
All right, very good. Next, I'm going to go ahead and palpate your arms. They are symmetrical, even muscle tone, skin color is normal for ethnicity, hair distribution is normal. I'm going to go ahead and have you put your arms straight out for me so I can go ahead. Oh, and sorry, we're skipping ahead. First, I'm going to go ahead and test your radial pulses. All right, they're 2+ bilaterally. And then I'm going to go ahead and feel for your brachial pulses. All right, they're also 2+ bilaterally. And then I'm going to feel for the epitrochlear nodes, which should not be palpable. And very good, they are not. Now we're going to go ahead and test the range of motion of your arms and shoulders. So go ahead and keep those arms straight out for me. I'm going to go ahead and put my hands on top of your arms. I'm going to push down, and I want you to resist, okay? Perfect. And I'm going to go on the bottom and also push up now and have you resist. Perfect. All right. Next, I'm going to have you you keep your arms palms up, straight out for me. I'm going to have you close your eyes. I'm going to count for 10 seconds and see if I notice any drift. So go ahead and close your eyes. All right. After 10 seconds, I do not notice a drift. So very good. Now I'm going to have you go ahead and flex your arms up like this. And I'm going to test your resistance again. So I'm going to push against you or pull against you. And then I'm going to go ahead and push against you. All right, very good. Any pain or discomfort with any of these motions?
No.
All right, very good. Next, we're going to go ahead and test the range of motion of your shoulders. So I'm going to have you go ahead and stand up for me. Just be careful. Let me know if you feel dizzy.
No.
All right, very good. For this next move, I'm going to go ahead and test your flexion. So I'm going to have you put your arms out in front of you and put your arms straight up into the air. Any pain or discomfort with this motion?
No.
All right, we're going to go ahead and go back down. And then we're going to test have you hyperextend your arms back. So go ahead and put them out back. Any pain?
No.
All right, very good. Next, we're going to have you put your arms back at your side, palms up. And then we're going to go ahead and test for abduction of your shoulders. I'm going to have you go put your arms up like you're doing jumping jacks. So go up. All right, feel okay?
Yeah.
All right, and then we're going to go down for adduction. All right, very good. Next, I'm going to test the external rotation of your shoulders. I'm going to have you bend your arms at your sides, palms up, thumbs out, and then we're going to go ahead and keep your arms at your sides and go ahead and move your hands out for me. All right, while your hand and your arms are out, I'm going to go ahead and push against you and try to resist me, okay? Good. And now I'm going to try to pull against you and resist me, okay? Any pain or discomfort with these motions? All right, perfect. Next, I'm going to have you turn around. I'm going to test the internal rotation of your shoulder. I'm going to have you bend your arm behind you, thumb up, and have you slowly move your arm up your back. Very good. And as you can see, his arm is equal with the scapula, showing this as a good result. Next, I'm going to have you do the other arm in the same move. Very good. Also a good result as before. All right. And